So I am here with Dr. Staci Whitman on Science Corner. Dr. Staci Whitman is a nationally recognized leader in biologically aligned systems-based oral health care. Her work bridges the gap between clinical dentistry, functional medicine, and public health, empowering providers and patients alike to reimagine oral health care as a foundational pillar of systemic wellness. Dr. Whitman is passionate about root cause prevention, food system reform, and the oral gut-brain connection. Her teaching emphasizes cavity arrest and remineralization, airway optimization, pediatric growth and development, and the microbiome as a blueprint for lifelong health. Dr. Staci Whitman, thank you for joining me today on Science Corner.
Hi, Jordan. Thank you for having me.
So to get started, can you describe what inspired you to pursue dentistry and specifically what pushed you to focus on pediatric and functional dentistry?
Yes. Well, I was trained traditionally like every dentist is and needs to be, quite frankly. But when I graduated and I got out into the world and started practicing, I realized how much I didn't enjoy my career because I felt like I was just playing whack-a-mole and dealing with end-stage disease chronically. And for all of us who've gone to the dentist, there isn't a lot of metrics or data. There's certainly not a lot of nutritional guidance or whole body health discussion. It's sort of like brush and floss and use this toothpaste and see you in 6 months. But I would find that patients kept coming in with cavities and gum disease, no matter how much we emphasize those basic concepts that dentistry focuses on. And I just said, we are missing something here. And this mouth is connected to the human. And we know there are many cross links, right? We're not connecting the dots. And I almost left dentistry because I was really miserable. And I myself lived a cleaner, healthier life, if you will, and was very into optimization and nutrition. And I thought, well, why don't I try to start applying some of these principles to the way I practiced? But I knew the only way to truly get upstream was to work with children. So that is why I went back into pediatrics. It was because I wanted to prevent the disease long before it became established. Because once you do start getting into a chronic disease cycle, it's very hard to manage. So I went back into pediatrics and I graduated, and it still was just kind of the same thing. Now you just have a higher volume of patients. And so I really said, I need to completely change my practice model. And that's when I found functional medicine, and I got my functional medicine certification and my functional diagnostics training, meaning how to run and interpret labs, and really dug deep into nutrition and supplementation and just longevity and optimization. And that's where we are today.
Awesome. And so many people, I think, and myself included before this call, view the mouth as separate from the rest of the body when it comes to healthcare. And I think that's a distinction that a lot of people make. So when you are working with families, when you're working with patients, how do you explain this oral systemic connection that kind of brings these two worlds together that have traditionally been rather disparate?
Yeah. Well, I point that out. I point out how we can't compartmentalize ourselves. And most patients, they understand this. It's the providers that struggle with this. So I also like to emphasize the mouth is the gateway into the body. I mean, it truly is. It's the beginning of the digestive system. We can see things going off the rails in the mouth long before it shows up on blood work, long before you start seeing symptoms in the body. We swallow 2,000 times a day. So the bacteria in our mouth are constantly seeding our gut. And so if you have bad pathogenic bacteria in your mouth from cavities, gum disease, etc., you're going to be affecting your lower GI system as well. And so I just point out that, we have to put the mouth back into the body. There's a whole human here and everything is connected. And most that really resonates with many patients because many of them have lived a life of dental disease and they know something's missing. And a lot of times it can be nutritional deficiencies. Like you can see cracks in the mouth or ulcerations, or you can see iron deficiency in the mouth, and ulcerations and cracks can be vitamin B deficiencies. Cavities can be a sign of vitamin D deficiencies and fat soluble vitamin deficiency. There's the nitric oxide pathway. We can see hormone imbalances in the mouth. Many people are starting to pay more attention to airway health too. And, we breathe 25,000 times a day. So the bacteria in our mouth are also impacting our lungs, our lung microbiome. And once you start thinking about it, you realize it's all connected. And so I really believe the future of medicine is in the mouth. Dentistry has been over here, medicine's been over here. We have to unite and add it as part of the conversation, and especially in the longevity optimization conversation, it's missing. I go to these conferences and not many people are talking about oral health, but I will tell you the public is very interested in it. So because everyone has a dental story or dental experience, and so it's exciting. I appreciate being given the opportunity to kind of re-educate and re-emphasize that this is the missing piece of the puzzle for many patients.
Yeah. And I think, when you say the mouth is the gateway to the body, when you say it, it sounds common sense, but I think it's one of those things that's not common sense until you hear it. And now it's like, why are we not thinking about it this way? It makes good sense. And so you brought up airway health, and you've spent a lot of your career focused on pediatric sleep, airway health. How do airway issues show up in the dental chair, and what are some of those downstream effects of overall health with those factors?
Yeah, it's pretty obvious. You can spot an airway issue once you're trained across a room.
Oh, wow.
You can see if a patient's mouth is open. Do they have dark circles? That's called venous pooling. I'm always looking at posture. That forward head posture is a sign you're subconsciously opening your airway, and then you develop really bad posture as a result. So that's the first assessment, but we're also looking for things like wear on the teeth. That's a sign of clenching and grinding. You can get microfractures. Just the way the teeth are lining up, the way the jaws line up can tell you a lot. Where is the tongue? Does the tongue stay up? Is the tongue low? So it's all muscle imbalances and things. There's a lot we can do to screen, but then we say, well, what do we do? And why are these issues happening? So we do know the human face and skull are shrinking. If you look at humans ancestrally 10,000, 12,000 years ago, we had big, wide jaws. Our teeth all fit very straight and aligned. We didn't have orthodontists, right? But now it's like everyone has crowded teeth. Everyone, quote unquote, needs braces. And many people have airway breathing issues. Chronic allergies, they mouth breathe, they snore, they grind, they clench. They're just not getting proper oxygen at night. And this especially impacts children because when we breathe through our mouth, not our nose, humans are meant to be obligate nasal breathers. We're not meant to breathe through our mouth unless it's used as a backup system, if you will. So we get 20% less oxygen to our brain. So what is that doing to a developing child? It's not great. And so many of these kids will get pegged with ADHD or behavioral issues. And it really could be they're just not breathing and sleeping optimally. So when you clench and grind and mouth breathe and wake up a lot at night, you're not getting into deep restorative sleep. Though that is where all the magic happens. The lymphatic system, we detoxify. This is where our hormones optimize. This is where our immune system optimizes, our microbiome optimizes. So if you're staying in these lighter stages of sleep, not only are you going to feel like garbage, but it actually is having a systems biological downstream impact. And imagine this compounding day after day, week after week, year after year. What is that human going to look like in their 40s and their 50s? And that's when you get prescribed this CPAP, right? And then you're put on antidepressants, and then you're put on maybe GLP-1s because you're overweight. And a lot of this can stem back, years prior from just if we could course correct this airway issue. And that's partly why I love working with the pediatric population too, is they're malleable. I can change the way they're growing. You have one shot to grow a face. And if I can change that, usually you only have until about the age of 10. So if we can course correct them, you are changing that child's health trajectory indefinitely. So it's something I'm very passionate about, and it isn't discussed enough. And also, it's important to know patients that chronically mouth breathe, they tend to be very nutrient deficient. They have micronutrient deficiencies usually. Their mouth dries out, so they're more prone to cavities, tonsil stones, bad breath. So there's a lot. They can have, more reflux and gut dysbiosis issues too. So it's profoundly important to understand how you're breathing.
Wow, that's super interesting. So it sounds like a lot of issues associated with dental health really become factors that are preventative if we are making the right steps upstream. And so I know, myself included, most patients tend to assume that brushing, flossing are, that's what we're told, that's what's sufficient. But where do things like nutrition and supplementation fit into this kind of comprehensive oral health strategy?
Yeah, it's the first thing I think of. So when a child comes in or a patient comes to me and they have decay or they have really chronic gum disease they can't get under control, you know, of course I ask, well, tell me about your brushing and flossing routine. But I usually don't go there. I want to know, what's your diet like? How often are you eating? Are you hydrated? You know, what is your nutrient profile like? When's the last time you had blood drawn? Has anyone looked at a micronutrient panel on you? How about just a plain old vitamin D? Do you know your vitamin D status? I mean, it can be very challenging to get some physicians to run these tests on patients, you know, and so we know vitamin D deficiency, fat soluble vitamin deficiencies are very much linked to decay and cavities. I mean, it's essentially, it's bone health, you know, your teeth and bone, they develop the same way as with magnesium and minerals. So this is what I think of with decay. When I see bleeding gums, I think, I wonder if you're vitamin C deficient. We all are familiar with scurvy, right? I mean, how much vitamin C do we get anymore if you're not eating mindfully, right? And if you're eating an ultra processed modern diet, you get very little. So maybe that's why your gums are bleeding. B vitamin deficiency, zinc deficiency. So supplementation is a big part of my practice, and almost everyone I recommend some form of supplementation as a baseline. And then I do like to have data and metrics to understand where we can fill in the gaps to really optimize. And once, interestingly, like everything, it's connected. And so once we fix some of these deficiencies, we notice a lot of the oral health issues improve, which is great.
That's really amazing. So I mean, I would never have thought about supplementation as a preventative factor for oral health. But again, as you talk through it and you make those links, I think that makes so much sense.
The other component is saliva. So we don't take our spit seriously, but your spit is this golden elixir of your body that is filled with micronutrients. It's filled with calcium and phosphorus and all of these amazing ions and enzymes. And it's important that it also is nutrient rich. And so supplementation actually helps your saliva as well. I mean, we talk a lot about electrolytes, right? So that is all part of it. You want to make sure your saliva is pH balanced. It's not too acidic. It's not too alkaline. It has to be right in the right neutral zone. It needs enough minerals to actually push minerals back into your teeth, which that is a real thing. Many people have not even heard of that before, but your saliva is what starts the mineralization process of your teeth. So your spit matters.
Wow. All fascinating. And so taking account for this, like this is all creating an oral microbiome. And we've heard this, we a lot of times talk about the microbiome with regard to the gut and things like that, but the oral microbiome has become a major area of interest. How do things like prebiotics, probiotics influence oral health? And do you consider them useful at all?
Yeah, I do. I think just like with gut health or any microbiome that we're studying now, we're learning that perhaps we could tailor things to be more bio-individualized based on the microbiota of that human. But that being said, prebiotics are incredibly important. Again, we need to be mindful. We don't want to overfeed the wrong bugs and underfeed those. But generally, if you eat a lot of plant-rich foods, a lot of fibers, that's going to help your oral microbiome, the good bacteria of the mouth. You know, our healthy bacteria, they love prebiotic fiber. Our bad bacteria, pathogenic bacteria, they love fermentable carbohydrates. So crackers, chips, pretzels, granola bars, fruit snacks, those are the things that cause decay because the bad bacteria consume those foods and they release acid as a byproduct. It's the acid that causes a cavity. People think it's sugar. It's not. It's acid. The bacteria consume the carbs and the sugar, and then it's the acid. So the microbiome, you know, I do like, there's specified targeted bacteria that we know that can boost the oral microbiome. And there are oral probiotics now in the market. There's oral prebiotics. We're seeing syn and postbiotics pop up. So we know too, like if we feed the mouth, it's going to influence the gut. Okay. So I do think we need to be treating these together. And part of my passion is to educate physicians, naturopaths, functional medicine doctors who focus on gut health. I was like, you guys, you have to be looking at the mouth, because if you're not, again, you swallow 2,000 times a day. So if this is a disaster, you have gum disease and bad breath and cavities, but you're doing this gut protocol, you're just going to keep re-inoculating these bad bacteria, which can survive the stomach acid, certain bacteria, and we know they can inoculate and affect the GI tract. So we have to been treating them together. And so I do think pre and probiotics have a very significant place in there. And I do love fermented foods too. I like to look for what we can most naturally. So trying to encourage patients to eat, a serving of fermented food every day.
Got it. Super interesting. And so patients, families, maybe parents of children that are looking to use supplements to support oral health, what are some of the biggest mistakes you see, and how can we help people avoid them?
Yeah, I think, first of all, I think they feel lost. Like there's just too much information out there, especially, and there's a lot of incorrect information out there. So I think first they feel lost. So it's just helping to streamline things. I think there's a very much less is more approach to these things, but it's also knowing that not every supplement is the same, right? And we need to be looking for high quality, third-party tested, really well verified based on the data and clinical trial type of supplements. And this is why we look for companies that really promote, these higher quality things, not just off the grocery store or pharmacy shelf. So, especially being very careful with things like probiotics and like fish oils and things that can easily degrade and go rancid. I think that's a problem. And then more isn't always better, we need to follow protocols, but also not everyone needs everything. So just because this person has this stack every day, you might need something totally different based on your biochemistry and your results and your needs. And so I think we tend to make everything too black and white, and that's the problem with social media. And this is where personalized medicine is really important, and that includes our supplementation routine.
Got it. I mean, I love hearing third-party tested. I love hearing high quality. I mean, that's kind of why SuppCo exists, is to help people make those choices in general. So I love the call out to being mindful about not just picking a supplement, but picking the right supplement. So that's always a good reminder.
Yeah, and you want to make sure it's working. I mean, some of these supplements, like what's even in them, and so we need to be cautious of this. There's so much bad marketing out there, and so we need to be aware of that.
Yeah, completely agree. And so I want to just shift gears a little bit. There's an ongoing debate, and it keeps coming up even more and more these days around fluoride, particularly how it affects and is good for or bad for children. And how do you approach conversations about fluoride with parents and in a balanced evidence way, knowing, as you mentioned, social media, people are getting information from all different channels?
Yeah, it's tricky. I like to meet people where they're at. So do they want to have the conversation with me, or is their mind already made up? So I used to be a huge fluoride advocate. I was a traditionally trained dentist, and my mind has changed a bit based on the latest data. I think there's a time and place for it, but I think delivery system matters. So I am not a proponent of systemic fluoride. I do not think we need to be ingesting it. That means I do not think it should be on our water. I do not think we need supplements. It has been shown in the data that fluoride works topically, not systemically. So you do not need to be ingesting it. So topically means toothpaste, rinses, the varnishes at the dental office. When we are advising patients to use fluoride products, we are supposed to be doing a risk assessment. Are you low risk, moderate risk, or high risk? And this has just vanished. Now it's like everyone needs fluoride. You need it in your toothpaste, you need it in a rinse, you need varnish, you need supplements, you need it in your water. We are over fluoridated. And this is why we see so much dental fluorosis now, up to 40. I've even seen a more recent study that shows 60% of teenagers have dental fluorosis. That's the modeling of the teeth. That's the first sign of fluoride toxicity. You're just getting too much of it. And people will argue, well, that's just aesthetic. But I would say, well, who are you to say that that child or human wants spotty mottled teeth? They now need veneers, etc. Okay, so I believe in high risk populations or in populations where they don't have access to other alternatives. I think a fluoride toothpaste is great. They can go to the dollar store or have their dentist give it to them and get fluoride toothpaste. Maybe they do the fluoride varnish twice a year at the dentist. I think that's wonderful. There are different remineralizing agents that are my preference, if accessible, and that is like hydroxyapatite. Theobromine is a great one. Even xylitol can help modulate the microbiome, and it can have some remineralizing benefits to it too. My concern with fluoride, even topically, is the microbiome. So fluoride is antimicrobial, but it's not selective. And we do have data showing what drinking or ingesting it can do to the gut microbiome, and it's not good. Because it can wipe out commensal and healthy bacteria, and it can decrease diversity. And so it can do that to the mouth too. Okay, so we just need to be mindful about this. Again, I don't think anything is black and white. The problem I find though with fluoride is that everyone just puts all of their weight in it, even dentists saying, well, if you use fluoride, you'll be cavity free. It's just not true. If that were true, then cavities wouldn't be the top chronic disease globally and in our nation, where we have ample access to fluoride. So something's missing from the conversation. And what is it? Nutrient deficiencies. How are we breathing? What are we eating? That's the big one, food. Okay, so ancestral humans didn't used to get cavities. If you look back 12,000 years ago, if you look at an ancestral skull, pristine, no decay. Maybe if they lived in areas of high fruit or honey, we might see some decay, but overall, no. When we were more of a hunter-gatherer society, but this has shifted. And then the agricultural revolution happened and the industrial revolution happened. We started milling, we started processing, we started eating flour and sugar. We stopped chewing, we're inhaling our food, and now we eat all day long. And this is the real problem. So it's not that fluoride will fix the issue. It's sort of it is a protective layer, but it's not 100% guaranteed. And so I see plenty of patients and kids who use fluoride products and they still get rampant decay. And it's because they're eating Takis and drinking Mountain Dew, and they're just not optimized, and they're nutrient deficient as a result too. And so it's like chicken or the egg, but I think we're really missing the point where all we talk about is fluoride, and we really should be focusing on nutrition and nutrient supplementation too.
Got it. I mean, that makes a lot of sense to me. And so based on let's assume somebody's eating proper nutrition and they're looking at supplementation. Do your supplement recommendations change across life stages? So early childhood, adolescence, adulthood, do you change your perspectives based on that, or is it still based on more other biomarkers?
Good question. They do. I mean, I do like metrics and data, of course, but yeah, as we age, things do shift. We tend to need more electrolytes, more minerals, but also for me, it's more the zinc and the B vitamins and the vitamin C. So we see more gum issues, periodontal issues as we age. It's less common in the pediatric population. So if a teenager is coming in, or someone in their 20s, 30s and beyond, and their gum health we can't get it under control, we have to look nutritionally and to see where they're deficient. And a lot of times when you fill in those gaps, their gums start bleeding, their bone health and bone integrity gets healthier again. And also targeting the microbiome, so we need to be oral microbiome testing. So this is a salivary analysis now. Many people are familiar with gut mapping and gut testing and gut zoomers. Well, you can test the microbiome of the mouth too, and it's very easy. It's just saliva. So you spit, send it out, and you can get a full understanding of all the bacteria, the fungi, the viruses, the protozoa, the archaea, all in your mouth. And then how are they all interacting? And then we can make tailored, personalized protocols to help eradicate or at least lessen some of the pathogens and get things back in balance too. And once we do that, the patient's whole body health will improve.
Got it. Okay. This has been fantastic. So one last question for you, Staci. looking ahead, what areas of research or emerging approaches to oral health are you most excited about? And I'm thinking particularly in this intersection of dentistry, nutrition, and whole body health and how all that works together.
Yeah, I think functional dentistry in general. I mean, many of us are familiar with functional medicine. We think we need to be taking a systems biology approach and a root cause approach to dental health as well. And that includes empowering dentists to look at data, being okay with requesting a vitamin D workup or like a panel, go get your blood drawn from your pediatrician for these targeted things, just so we can see where we can fill in the gap. So I think that's really cool. Peptides, believe it or not, are finding their way into dentistry and stem cell research and things too. But I think just the microbiome in general, we have a long way to go. I think we've just begun understanding how all these bugs communicate to one another, and they work synergistically or in opposition. And I do really like the idea of personalized medicine. It's tricky. It's nice on paper, and some of this is hard to implement from a protocol standpoint. But I think just truly it's through education and explaining and letting patients know that you are all different, and what works for you may not work for someone else or for a friend or a loved one. So I'm just excited. And honestly, I'm just excited that people are talking about oral health. I think that's the big one. That's the big takeaway right now, is just let's get the mouth back into the conversation, back into the body.
Awesome. Like you say, the mouth is the gateway to the body. Dr. Staci Whitman, thank you so much for joining Science Corner. It's been a pleasure.
Thank you, Jordan. Appreciate it.